am Jane E. Ogao-ogao, a BS nursing student at Huzurza Memorial State University, Dapitan City. In this video, I will be performing a return demonstration on assessing the cardiovascular system. Good morning, sir. I am Jane E. Ogao-ogao, a student nurse from Huzurza Memorial State University, Dapitan campus. And today, I am your nurse. And you are?
Summer Thomas.
Okay, sir. So today, I am going to assess your cardiovascular system or your heart in order for me to know if there's a problem or abnormalities with your heart. Is it okay for you, sir?
Yes.
Okay, so don't worry because I will give you 100% privacy because the doors are locked and the curtains are closed. So shall we start?
Yes.
But before that, so I have here some questions to ask about your past health history. First, do you feel chest pain or you feel uncomfortable?
No.
Okay. So do you have a past history such as cardiac arrest?
No.
Okay. So do you have a history of heart disease in your family?
None.
Okay. Okay, so before we proceed, sir, can you please wear this gown? Okay, sir. I'm going to put this blanket to cover any exposed areas that aren't yet included to the examination of your posterior thorax. Okay, so let's proceed to the working phase, your assessment of the neck vessels. So stand on the right of the patient, then position the patient into a supine position with the head elevated to 30 to 40 degrees. Then instruct the patient or client to turn the head slightly to the left side and show the tangible light source into the neck suprasternal and area around the clavicles to observe for palpitations. If the jugular distillation is found, assess for jugular venous pressure by locating the highest visible point of distinction of the internal jugular vein. Emphasize the distinction as did necessary. Raise or lower the head of the bed until the highest visible point of the distinction of the jugular vein was observed. So measure the vertical distance in centimeter above the external angle by extending a long rectangular object horizontally from this point and a centimeter ruler vertically from this external angle, making an exact right angle. Then do the same thing to the other side. So now let's proceed with the assessing the carotid artery. So with the head of the bed slightly elevated, position the client's head toward the side being examined. So palpate the carotid arteries, cautiously avoiding too much pressure or massaging the area. Then turn the client's head slightly away from the side being examined. Then place this stethoscope over the carotid artery. So ask the patient to hold his breath for a moment, then auscultate the carotid. Okay, sir. So I'm going to check your neck. Please turn to the right. Okay, so let's proceed to the assessment of the heart or precordium, inspect and palpation. So begin with the general inspection of the chest wall and look for any abnormal pulsation. Shine a tangible light across the chest wall over the cardiac apex to make this movement more visible. So simultaneously inspect for the precordium for pulsations while palpating the aortic area, pulmonic area, and trigger speed area and the apical area. And the following techniques: palpate the eyes and the left using the palm and hold finger pads flat or obliquely against the chest. For trails, press the ball of the hand firmly on the chest. Check for vibratory station caused by the underlying turbulent flow. Then palpate the apical impulses using the palmar surface of 2 to 3 middle fingers. Then, for the finer assessment, palpate with one finger alone to confirm the characteristic of the apical impulse. Noting for the location, diameter, and amplitude. If unable to palpate the apical impulse of the patient supine, to position the roll partly into the left lateral side. Sir, can you please roll over? Okay. Ask the patient to exhale fully and stop breathing for a few seconds. Palpate again as the patient maintains to be partly facing to the left side. Okay, sir, can you please exhale fully and stop breathing? Okay. Inspect and palpate the epigastric area of the base of the sternum for abdominal aortic positions. Okay, sir, upon assessing your precordium while inspecting and palpating your aortic, your pulmonic area and tricuspid area are no pulsation and no lift. In the apical area, pulsations are visible and possible in most and no lift. In epigastric area, it is normal because of the aortic pulsation. So now, let's proceed to the auscultation. So assess for heart rate and rhythm by placing the stethoscope at the apex and listening closely to the rate and rhythm of the apical impulse. Count the heartbeat of a full minute. If irregular rhythm was detected, assess for the pulse rate. Use the diaphragm of the stethoscope first, then the bowel, then auscultate the heart in 4 anatomic signs such as aortic, pulmonic, tricuspid, and mitral for heart sounds. Ask the client to repeat regularly while auscultating. Repeat the preceding steps while the patient is in lift lateral position. Then at sitting position, leaning forward and briefly, then stop breathing after exhalation. So sir, I'm going to assess for your heart rate and rhythm. Can you please inhale and exhale? Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay, sir. So your stool is shorter and your diastole is at normal heart rate, of course. So S3 is heart since you are an adult. So now, let's proceed in assessing the peripheral vascular system at the upper extremities. So, assess each arm size, symmetry, skin color, and temperature from fingertips to shoulder. Note for any presence of edema, lesions, changes in skin textures, and hair distribution. Inspect the peripheral veins in the arms for the presence and appearance of superficial veins when limbs are dependent and when limbs are elevated. So now I'm going to check for edema, lesions, and skin textures. Okay, so your temperature is warm and your skin texture is persistent and there's no lesions. So now I'm going to check for capillary refill. Okay. So sir, how do you feel right now?
I feel alright.
Okay. So by the way, the summary of the findings of the assessment a while ago is it all good and normal, just like I've said a while ago, and take your habits good as well as take care of yourself. So do you have any clarifications or concerns?
No.
Okay, so thank you for your time and cooperation and have a good day.